Welcome to TotalMD. In today's video, we're going to get into the EHR portions of the software. First, I'm going to go to the Setup button and click on Set up the practice. We do have an EHR Settings tab, and this is where you can choose a few of your office's preferences, such as do you want to measure a patient's temperature in Celsius or Fahrenheit? And for height and weight, do you use the metric system or the imperial system, such as pounds? We also have some additional EHR features here that you can choose to display, such as e-prescribing links, vital signs, labs and lab results, immunizations, syndromic surveillance, and medications. I would go ahead and leave all of those turned on for the time being until you truly know that you don't need them. We do have a TotalMD Direct Account ID listed right here, and that is for your patient portal or to send secure email messages to your patient or to other providers. If you do not have account information listed here, and you are going to be using the patient portal or TotalMD Direct, you will need to speak with our sales department in order to purchase that feature. And once you have, someone in tech support will be setting that up for you. I'm going to go ahead and save my changes. And also under Setup, let's take a look at our users. We're going to go ahead and edit the doctor as a user in this screen. And I want to point out that we do have an external ID and a password filled in here. And that is the ID and password for our DrFirst feature. DrFirst is for e-prescribing. Once again, you'll want to make sure that you do sign up for that with our sales department. We also have your TotalMD Direct username and password listed down here. And that is something that our tech support department will plug in for you, as well as the DrFirst information. And then we do have this doctor selected to be a licensed professional. So therefore, anything that this doctor signs in under and utilizes, it is being tracked as a licensed professional making those changes in the system. Exiting the screen, I do want to go down to the EHR setup section at the bottom. We're not going to get into creating any templates today, but I do want to point out that this is where the templates are housed. You can create mini templates, which will go under Manage Categories and Notes, and then those templates can be attached into the Encounter template as a whole. So think of the Manage Categories and Notes as pieces of the puzzle, and the giant picture of the puzzle is the Encounter template. You can import and export templates to pass to and from other offices. We do have SNOMED codes in the system that are available to use. We do have our ICD-9 and ICD-10 codes mapped to the SNOMED codes. And we have a table lookup, which will essentially let us look up SNOMED codes as they pertain to the different items under this lookup list. On your homepage, something you may want to customize and add to either your daily activities or a task menu for one of the staff members is to view unsigned encounters and view open orders. Just so you've seen how those items are set up, under the homepage, I'm going to click Customize this page. We'll go to Daily Activities. You're going to create new category items, and the name is going to be View Unsigned Encounters. The other name will be Open Orders. Both of those items you'll want to choose Display Information, and then you'll be able to select from the drop-down list what you'd like to insert in that space. Number of open encounters is my option here, and number of open orders. That's a really handy tool to add to your homepage for easy access for the doctor to know which encounters he or she needs to go in and sign off on and what orders are still pending. I also want to point out that we do have an exclamation point here in the top right corner of the screen. If I click on that, it's going to show me how many prescriptions are pending to be sent. That means one of the clinical staff may have created a prescription and is waiting for the doctor to review, punch in his or her password, and send that prescription out to the pharmacy. So that's also a nice little handy tool right there at the top of your screen. I'm going to go ahead and get into creating an encounter, and then we'll work our way into the list menu and the activities menu so we can go over the EHR functions inside of here as they pertain to what we come across. So I can start a couple of ways. I can go to my patient list, select my patient, such as Mary Grant, and then right-click and go down to New Encounter. I can also double-click on her name or edit the patient, open up her patient information screen, go to the encounter summary, and create a new encounter from here. Or my third option is to go to our scheduler, select the patient's appointment, right-click for options, and go to New Encounter here. Before I actually begin a new encounter, I'm going to open up the patient's information screen and point out some pertinent fields that you'll want to fill in. You'll of course want the patient's full first and last name, a street address. More importantly, you have to have a zip code in the system for the e-prescribing to pick up your patient's data. You will want to have a home phone number. Even if it's not the patient's home phone and it's just a mobile number, you will want to have a phone number in the home number position as well for e-prescribing. To utilize the patient portal or TotalMD Direct, you are going to want to have an email address on file. You're going to want to select the patient's preferred contact method and the contact preference down here as well. On the right-hand side of the screen, you are going to want to put in the patient's gender and date of birth. You'll also want to fill in the ethnicity, language, and race. Those are the items that will be required to find your patient in the e-prescribing section of the system and also be utilized for TotalMD Direct. So I'm going to save my changes, select my patient's appointment, right-click, and go to New Encounter. Your system should come preloaded with a number of templates that we've built here at TotalMD, and the purpose of these templates is to help you organize the type of visit that the patient is going to experience. For example, we do have an option for OB visit. If Mary is not pregnant, we certainly don't want to use that template. We also have pediatric templates in the system. Again, if they apply, you can choose one of these to use. I'm going to go ahead and select the history template to begin with Mary, since we are going to call this visit for her a new patient visit. Keep in mind, these templates are coming from the setup section of your system and have been placed in there for you to utilize. You can create your own custom templates if you'd like to, or you can commission the TotalMD staff to do so for you. I'm going to go ahead and select Use Template. The purpose of the template is basically to help you categorize what type of visit the patient should be having. And there is different data wrapped up inside each of those templates that will pertain to the specific appointment type that's depicted on the template. In opening this template up, we do have a confirm message here in the middle of our screen that says the patient's assigned provider does not match the appointment's provider. Click yes to use the appointment provider or no to use the assigned provider. So typically, Mary may see one specific provider, but for this appointment, she's seeing another. So I'm going to go ahead and choose yes to use the appointments provider, assuming that that's the licensed professional that's going to be completing Mary's appointment. We have a number of tabs up here at the top of the screen, and we'll be working through all of those. First, we'll start by putting in Mary's chief complaint. The chief complaint is the purpose of her office visit for the day. I'm going to call this an initial exam appointment. We do have the visit date populated here automatically, and the provider will populate automatically. If the patient is going to see multiple providers during this encounter, you do have a second and a third section to choose an alternate provider. If this happens to be a phone call that Mary puts into the office and it's not an actual office visit, but you'd still like to create an encounter summary for that, you are going to go ahead and mark not an office visit. If the patient was referred to you or transferred to you by another provider, you're going to go ahead and mark that this is a transfer of care. In the next drop down over, you're going to choose which provider transferred or referred that patient to you. We'll say Penny Puffer. If there was a transfer of care, you do have to perform a medication reconciliation. What that means is you did verify what medications the patient is taking. and that's going to be performed through our DrFirst or E-perscribing section. If you do not have DrFirst, you can go ahead and mark meds reconciliation performed and put in the date that you did reconcile their medications. You may be able to do a meds reconciliation off of the transfer of care summary that the referring provider sent over to the office, either with the patient or via email. However, if you are performing meaningful use, keep in mind this alone may not meet the meaningful use requirement. Next, we have the vitals section. We're going to go ahead and put in today's date as having taken the vitals. We have a section for the systolic and diastolic blood pressure. We can go ahead and plug in our numbers, 120/80. The blood pressure position, was the patient sitting, standing, or supine? We'll say sitting. The blood pressure location is going to be left arm or right arm. The patient's weight, and you can see that that is in pounds because that's what I set in my setup screen. The patient's height in inches, and we'll go ahead and punch in a figure there. The system will automatically calculate the patient's estimated body mass index based on their height and weight for you. And you can go ahead and plug in a number if you happen to know what percentile that puts the patient in for their body mass index. We do have a space for head circumference if you are measuring that in your office. The patient's temperature if you are taking that in Fahrenheit degrees. What type of thermometer did you use? What their pulse rate is in beats per minute. The pulse location. And if you'll be providing nutritional counseling, physical activity counseling, or any additional notes you'd like to make here. To access the notes of this vital section, you will need to double click inside this space. Once you're done adding your notes, click the OK button and it will populate here. We also have a section to track the patient's smoking status, and we have a number of options here. We'll go ahead with light tobacco smoker. It does give you the option to put in the date that the patient began smoking. Most patients have an approximation as to how long they've been smoking, and let's go ahead and say Mary's been smoking for 5 years. To make it easy on ourselves, I'm just going to click on the year. You can see we do have a narrow scope of years available here, so I'm going to go ahead and just type in 2010. If you are planning to provide tobacco cessation intervention, please check the box. And if the patient is currently not taking any medications, please check that box as well. You can see that there are currently medications entered in the system for this patient, and it's asking us to verify if we want to specify no current meds. I'm going to go ahead and say no, but I wanted to show you that there are helpful tools built into the system to give you alerts like that. Next, we come to the templated section of this patient's encounter. All of the items up here at the top are hard-coded into the system, and those will not be changing. You will always have a place for chief complaint, transfer of care, vitals, etc. Keep in mind that the questions are populated in here based on the type of template I selected, and that comes from the default templates that we load into your system for you. However, you can have those customized or customize them yourself. So I do have a section here for history of present illness. To activate the questions inside of that section, I'm going to click yes. When I click yes, on the right-hand side, our actual question populates. What is their history of present illness, the location, onset, quality, duration, character, etc. If I click inside the box, I can begin typing the information that the patient expresses to me. If you do use some sort of voice-activated note system, this will work for that system. Patient wanting to establish a new primary care physician due to previous primary care physician retirement. No issues present with the exception of B12 injections for energy. Once you're done typing your note, you're going to click the next button in the bottom right corner to move on to the next question. As I begin to add details into the system for this encounter, it's actually populating that data onto the encounter here on the right-hand side of the screen. You can click and drag that screen to expand it or hide it. And another pointer is you cannot click and type in this space and have it save onto the patient's encounter. Everything that's populated on this encounter form is coming from the data that you put inside the main portion of the system. So do your work on the left and it will populate on the right. Let's go ahead through the medical history for our patient Mary. So I'm going to click yes, and it's going to populate my question and answer section on the right-hand side of the screen. So enter the medical history, choose the medical problem and year. I'm going to go ahead and click the next button so that I could plug in any diseases that the patient has marked off from their medical history form, for example, asthma. And then I'll click the next button. It'll ask me when the asthma was diagnosed, and I can use my little calendar here and jump backwards in time. We're going to go ahead with February 2014 and then click the next button. After I clicked next, once I entered in the onset date for asthma, it takes me back to my original question, which is enter medical history, choose the medical problem and year. This is going to continue looping back to that same question until you are finished tracking any diseases or medical problems that the patient does have. So let's say that in addition to asthma, Mary also has diabetes. So what I need to do is click this line in order to enter in another item into her medical history, and then select the next button, choose diabetes, and then click the next button and select when the diabetes became active. Keep in mind you can click on the month or the year if you don't want to click back 1 month at a time. We're going to say she was diagnosed with diabetes in 2004 in the month of April, and then I can choose my date. Up here it's populating my answer that I just selected. So then I'm going to hit the next button, and once again we have the same question in order to populate any additional diseases. If Mary does not have anything additional aside from asthma and diabetes, I'm simply going to click the blank line and then choose my next button. It then moves on to the next question. Is she overweight, underweight, or normal? If I choose overweight or underweight, it does let me put in additional information. Let's go ahead and say that she is slightly overweight. Click the next button. Then it takes me to a section that shows me the SNOMED code for an overweight diagnosis. Here I don't have to do anything except for click the next button. So that's actually populating the SNOMED codes for you onto the patient's encounter that are already linked inside the template. The next section here is surgical history. Let's say Mary has not had any surgeries. We could click no or NA. If you choose NA for not applicable, it will not populate that section over here. If you do select no, that could be an indicator that you actually did ask her. So NA is going to exclude that item completely from the encounter. No is going to add it there with a no answer. We can go ahead to the social history section, and up here in the top you can see it's going to ask us about smoking, alcohol, and drug abuse. So first, to answer the smoking section, we do know already that she's a light tobacco user. So I'm going to go ahead and choose current smoker. And then you can see there's a little double arrow section here. Anytime you see that, that is going to represent an additional question to follow up to the answer you're selecting. So once I click the next button, it's going to ask me how many packs per day Mary smokes. We'll go ahead and click on the blank space and click next, because perhaps she doesn't smoke enough to qualify for even a pack per week. Moving on to the next section, do you drink alcohol? If I choose yes, again, we have an additional question to put in how much alcohol she does drink or any additional alcohol questions. We're going to go ahead and say no and move on to the next question. Drug abuser. Again, we have our yes with additional questions option or no. We'll select no here and click the next button and move on lastly to review of systems for the patient. I'm going to click yes to activate the questions section. And on the right-hand side, once again, we've got our questions and answers we can select. So for constitutional, I can choose one of my answers. We're going to go ahead with no complaints and click next. Eyes, we'll go ahead and choose patient denies and see what the next question is that the system leads us to. And it does give us a free form space to type in an answer for eyes. Patient had no complaints, but did comment that our sign was hard to read. Then I'm going to click the next button, and it takes me back to that same review of systems question for eyes. This allows me to select an additional answer to what I've already typed in. I'm going to go ahead and click the blank space because I don't have anything additional to add, and I'd like to move on to the next question. So now we have ears, nose, mouth, and throat. I'm going to go ahead and say no complaints. Click our next button. Cardiovascular, no complaints. Next. Respiratory, no shortness of breath, no rales, etc. Click next. Gastrointestinal, no complaints. And we can continue clicking through these items to round off our review of systems. We've got musculoskeletal, neurological, psychiatric. The one benefit to customizing those templates is that if those are items that your particular specialty does not review, in customizing the templates, you could cut those out. Because they are part of our template, I cannot skip answering some of those questions. I do have to see my way all the way through the review of systems question and answer section in order to move on past that point. So now that we've got the review of systems filled out, which could be done by your medical assistant or PA, we could stop here and save our changes and have the next staff member for the office come in and pick up the encounter form and continue editing it, or we can move on to the assessment section for the patient. I do want to point out that this is a great place to go into DrFirst and look at the E-perscribing section and indicate if the patient has any allergies or medications that they're currently taking. This is going to help us pass our meds reconciliation section. So in my options menu, I'm going to go ahead and click Manage Allergies. The web browser will go ahead and open up for DrFirst. And typically it'll pull up your patient if you have all of the patient data in that I specified earlier. In this case, we do have a test patient with fake data. So I'm going to go ahead and manually enter her, and then we can move on with managing the allergies. So if for some reason your patient does not pull up right away, we can type in the last name and try finding them and get as much data as possible for the patient. It did happen to find our Mary Grant, so I'm going to select her name, and we can proceed with managing her allergies. At the top of the DrFirst screen is your toolbar options. I'm going to go ahead and click Manage Allergies. We can confirm that this is for Mary Grant. We do have her birthday there to confirm as well. And I'm going to scroll down and see the active or current allergies for Mary. Right now we do have listed that she's allergic to aspirin that causes nausea, and that information was entered approximately a year ago. I do have the opportunity to modify that allergy, inactivate, or delete it if I find that that's not correct. So I may be a medical assistant in the office reviewing any allergies that Mary may have and be able to pull her up in the national database and confirm what another provider has already entered into the system for us, which certainly helps save us some time. You can also see that she's got an additional allergy here for bacillin. It causes her hives. It was entered on the same date, and again, modify, inactivate, or delete. There is a little blurb down here that the patient does not have any inactive allergies. If I've confirmed that those are the two allergies I was planning on entering for Mary and they already exist, I can go ahead and just click the Done with Allergies section. If I did need to add an additional allergy in for Mary, I would go up here to the common allergies list and see if I can find the prescription that she's allergic to now, perhaps codeine, and then I can click Add Common Allergy. If it is not on this list, just use this empty space to type in a few characters of the medication that she does have, click Find the medication she's allergic to through the main medication list. I'm going to go ahead and click Add Common Allergy, and then it shows me the allergy that I'm adding, codeine sulfate. I do have the opportunity to plug in what kind of reaction Mary has when she takes that. We'll say she experiences vomiting. You do have an additional space to type anything else in that's not part of this drop-down list. And then the onset date is when she first became allergic to codeine. We'll go ahead and say that it was sometime in June of this year that she began having that reaction. and then we'll click the Add button once we're done. Now we've effectively added an additional allergy to Mary's medication report that does go into the national database. This is really useful. For whatever reason, Mary showed up at the hospital unconscious and was not able to communicate with them which medications she's allergic to. The hospital could also pull up the national database and be able to see that and know not to give Mary any of those items because of the reaction that she'll have. I can choose to display a full medication report, which does show her current allergies. It also shows any inactive allergies and any current medications that she is taking. We also have a space for medication history and any problems that might have been entered into the national database. I do want to point out at the top of the screen, you do have a print option or a back option both here and here. We're going to go ahead back to the screen we were in previously. DrFirst, again, is also where you're going to do the medication reconciliation. We did just see her medication report, which we could do her reconciliation off of that. We could also click on Manage Medications, which will perform the same function. It's going to display all of the medications that she's been issued, the date she began those medications, and you do have the opportunity to modify, stop, or delete any one of these items. So if you determine that she should no longer be taking cephalexin, we can go ahead and click the stop button on that and say that as of today, we are completing her therapy, or put in any additional reason that she's stopping and click the stop medication button. Medications will only show up inside of DrFirst that have been electronically prescribed by another doctor. If the other doctor had been handwriting scripts, you will not find Mary's current medications inside of DrFirst. In that case, it's up to you to manage her medications and add any medications that she informs you she's taking. So here we do have our section to add a medication. I can choose from our favorites list of medications, which the office has compiled, or I can click here and type in the name of a medication we know she's taking. Perhaps ibuprofen. The great thing about this system is I don't have to type in the whole name of the medication. I can just type a few characters, hit the find button, and then it's going to show me all of the different medication options for what I've typed in thus far. So we do have ibuprofen in tablet form, 400 milligrams, 600, or 800. We do have ibuprofen in its generic form for Advil liquid gel, Advil migraine, or Walprofen. Ibuprofen generic for just plain old Advil. You do have chewable options in here, suspension options, children options, and we could go on with our list. I'm going to go ahead and select the Advil migraine option, and then I can continue entering in any additional medications that Mary tells me she's taking, whether it's over the counter or prescribed. Down below in the medication section, I do want to point out that we do have an option to mark that her medication history is now complete or unknown, and then we can go ahead and click the button that says Medications Reviewed. This is what's tracking that we did actually do a review of medications for our patient. I also want to point out that we do have a detailed report, a mini report, or a medication history report that we can print out for Mary regarding her medications. The Manage Medication section and the Manage Allergy section are really important to hitting your meaningful use criteria if you are participating in that program. So I do want to highlight that and point out that you will want to come into DrFirst and mark these sections off as we just did. Now that we are done with that portion, I'm going to go ahead and close the screen, and we are back on our encounter form, and we can move forward to the assessment tab of the encounter. The physical exam section is going to let us choose another template to populate here to go through physical exam questions that we'll be performing on Mary. To choose a template, I simply need to right-click in this space, select Add a Template, and then choose which template for the physical exam I'd like to use. Keep in mind these are different templates from the initial templates we chose for the subjective and objective of this encounter form. So the subjective and objective is going to be asking what's the purpose of the patient's visit and what the patient relays to you. The assessment section is your examination of the patient. So we're going to go ahead and stick with the standard exam template, and I'll select Use Template. We have our different exams that we can choose to go through. We do not need to enter female infant, so I'm going to go ahead and select Not Applicable for those options. And Mary is not male, so I'm going to go with Yes for exam note female. Once I choose Yes on that item, we do once again have our questions and answer options. Exam general inspection, so we're looking for oscillation, palpitation, and percussion. I can go ahead and select within normal limits or within normal limits and have a space to enter some additional information. I do also have abnormal, patient in NAD, or I can choose this section to open up. I'm going to go ahead and select that option and click the next button, and that populates a general freeform space for me to type in. So rather than choosing within normal limits or something else I'm unsure of, I have activated basically a space I can type anything I'd like. And perhaps here I prefer to spell out within normal limits, and then click the next button. Keep in mind that all of these answers you choose is what's going to populate on the encounter form. Pupils equal and reactive to light and accommodation. I'm going to go ahead and say within normal limits. We then have a section for chest. Go ahead and select chest expansion test, normal breathing with little effort, absence of wheezing, and crackles. And then click our next button. And then it takes us back to plug in any additional answer we would like to. I don't have anything additional to add, so I'm going to go ahead and choose within normal limits. Cardiovascular, we could say all within normal limits. Abdomen, edema, neurological, gynecological. And if you're not doing any portion of these exams, please do choose the blank line in place of within normal limits. So if I scroll to the bottom of our encounter form, you can see the answers that I've populated here. The next portion is the problem list for the patient. The current problems are coming from previous encounters, as you can see right here. If the patient is continuing to have these same problems, which are tied to ICD-9 or ICD-10 codes, I can go ahead and right-click on the box and set as a problem for this encounter as well. So if that problem has carried over, I can specify that here. Now we are pretending that this is Mary's first visit. So instead of choosing one of the existing problems, I'm going to create a new problem for Mary by going to the right-hand side of the screen, and I can look through my frequently used diagnosis codes, unused diagnosis codes, or search with a free text. So frequently used, I've got asthma here. I'm going to go ahead and double-click on that so that I can populate that as one of Mary's problems. I do get a pop-up that states there are multiple SNOMED codes that can be used in addition to that asthma ICD-9 or ICD-10 code. I'm going to go ahead and say yes to select a SNOMED code. Instead of now displaying your diagnosis codes, we are seeing the different SNOMED codes available to use. Hyperactive airway disease or extrinsic asthma without status. I'm going to go ahead and populate with this first option here, so I just double click on it, and it now adds it as an active diagnosis for our patient of asthma. I can change the type of diagnosis this is from acute to chronic, and we do have a scroll bar to go to the right, and you can see the diagnosing provider, diagnosis date, the status of the item, date of the status of the item, modified by what user, the SNOMED code that we did choose, and the description of that SNOMED code, and then we do have an intervention action. If the patient has no problems, you're going to go ahead and just check the box, no problems. I do want to point out that the problems list is something commonly part of the Meaningful Use program as well. At the bottom of the screen, we do have a section for Mary's cognitive and functional status. What that means is if there are any impairments that Mary might have, be it mental or physical, we can go ahead and enter those here onto her assessment. To add a cognitive and functional status, I'm going to choose a date first of today, and then in the description box, I'm going to right-click and select Add Cognitive and Functional Status. We do have one populated in the system as of right now that she could possibly be on crutches. If that's the case, we just check the box and click OK, If that is not the case and we'd like to add an additional option here, we can right-click, select Add a Status, and plug in a description of what the cognitive or functional status is. For example, you may have a patient come in with a mental disorder of sorts. That is a cognitive status that you would most likely like to have as part of the patient's encounter so that you can be aware of that. You can look up the SNOMED code and attach it here to that item by going to the setup screen and review SNOMEDs. If I do want to select that Mary has a mental disorder, again, just choose the box and click OK, and now it populates that information for me. I would suggest putting together a list of cognitive and functional statuses that you might want to add to the system. Go to your setup button, do a review of SNOMEDs, and in the filter, type in a word and click your enter button to search for a possible match. So we do have relationship problems with family members due to mental condition. So here is the SNOMED code that I could write down and plug into the cognitive and functional status section. You can also look up ICD-9 and ICD-10 codes if you happen to know what the diagnosis code is, and that will link to a particular SNOMED code that, once again, you can jot down and plug into the cognitive and functional status. I do want to point out that there are several places where we have these little plus signs in the system. The plus sign is going to expand the section that you're looking at. If you unclick it, it's going to contract it back to its original size. Moving forward to the plan section of the encounter summary, once again, I'm going to right-click in this space to add a template, and these templates are, again, created under the setup section. I do have a couple templates that I can choose from here by default. I'm going to go ahead and choose the new patient plan and then use template. Under assessment and plan, I'm going to click yes to activate that section. And over here, it simply gives me a space to type in the assessment of the patient. So under assessment, I did put patient seems to want to lose a few pounds, and the plan is to review the current diet and follow up in 4 weeks to track the patient's weight loss. I can then click the next button, and I have completed my new patient assessment and plan section. Keep in mind that the templates can be as extensive or as simple as you'd like them to be. You can have multiple different options based on the different plans that the doctor may come up with to help treat a patient. At the bottom of the screen, we do have a section called Care Plans. This is to lay out an instructional path for the patient in order to achieve the plan we have up here in the top. I can right-click and add another template to this section so that I could go forth and choose some additional pieces of information here for the patient. And I may decide to go ahead with a low back pain plan, for example. The actual plan for the assessment of low back pain may be physical therapy, chiropractic care with current chiropractor, and massage therapy. At the bottom of the screen, now that I've plugged in that we have a plan for a few items to lose a few pounds and also for her low back pain, I can go ahead and create care plans that will specify how we're going to accomplish those goals. So once again, I can right-click in this space here at the bottom of the screen, click Add a Care Plan, and we do currently have a weight loss goal already in the system. I can right-click on that and edit the care plan if I want to take a look as to what's inside of that weight loss plan. So the instructions are diet and exercise counseling provided during the patient's visit. Keep in mind this is a template that we can use for other people too, so you're not going to want to put in this patient's specific data. However, you can create additional care plans if there was another weight loss path that you wanted to lay out as a care plan for the patient. There's also one here for smoking cessation. Let's say we gave the patient that one, and I'm going to right-click and add a care plan as well. Put in our goal for the low back pain. Once again, if we had mapped the SNOMED code, we would be able to type that in here. And the instruction, you can lay out in any format you choose. So I've laid out a plan to continue seeing the chiropractor and then begin physical therapy 3 times per week. Use alternating ice and heat for flare-ups and massage therapy once a week for 60 minutes each visit. I'll click the Save button, and now I can attach that low back pain plan to our patient. The great thing about that is once we've created these care plans, those templates are in there to use for any patient. Also, if we scroll to the bottom of our encounter form and take a look at this section, the care plan does lay out the instructions for the patient very nicely. So at the end of this encounter, you can print a copy of the clinical summary and hand that off to the patient, and they know what steps they should be taking. The next section over is Notes and Review. To create a note, you're going to double click in this space, which will activate the box at the bottom, and we'll type in, "Patient is very pleasant and is looking forward to the care plans laid out to stop smoking, lose weight, and treat lower back pain." I can label this as a note, as discharge instructions, or just simple instructions for the patient. And then click my Save button, and now it's populated into the note section here at the top. We do have a section here for suggested procedures that we might offer the patient based on some specific criteria that Mary falls under. This is what we call a decision support rule. The decision support rules are created inside of our list menu and decision support list. As you can see, this is for a mammogram screening that we may suggest Mary have. The mammogram rule, if we take a look and edit that item, is basically saying that any patient that is older than 20 years old and has not had a procedure of a mammogram screening in our office yet and is a female should have the suggested procedure of the mammogram screening. I wanted to show you that that is where these suggested procedures are populating from. You can also create decision support rules to suggest educational documents be handed off to your patient based on certain criteria as well. In this case, the computer is suggesting that we might want to offer Mary a mammogram. The doctor themselves may decide if they want to suggest that item to the patient, ignore that item, or actually perform the treatment. We can go ahead and say that we did perform that treatment today if Mary does accept. That is therefore going to add this procedure as a completed item in the patient's ledger or account once the doctor signs off on this encounter. If we also happen to perform a chest x-ray today, we can double click on the item here. You do have a search space here to look for different CPT codes that you may have performed today, such as a blood glucose strip test. So I can double click on that to populate it here as well. If we're simply suggesting that the patient has it done, we can go ahead and change the status to suggested. And then if we did actually perform it, we are going to make sure we mark it performed. So the computer system will automatically suggest certain procedures based on criteria. And then you can also go to the right-hand side of the screen and add in whatever procedures you actually did complete today, such as an office or outpatient visit. I'm going to double click on that item to populate it here and make sure that that also says performed. If we did have any educational materials that pertain to Mary set up from that decision support rule, we would have that linked in down here at the bottom of the screen, which would also populate onto the encounter. This is a way of tracking what pamphlets you hand off to your patients that are educational pamphlets or different websites that you suggest they go take a look at. The next tab over is our Orders tab. We do have the option to link any problems that are coming from the assessment section in the problems list to any order that we'd like to give the patient. For example, we diagnosed the patient with asthma. Perhaps we want to do some sort of in-house test for asthma. So here I start to type breath, and I can find very quickly an in-house lab or test that I might want to attach to the patient and order them to have. So I'm going to select that item, assign this to a staff member to make sure it gets completed. We'll say to our clinical staff, and plug in any notes. This note section is a click and type section. I'm going to put in, please complete in 1 week, enter a due date, and whether or not I'm expecting results. I can also send the patient out for outside labs, for imaging and radiology orders. I can refer the patient to another provider, which this list of providers is coming from the address list in your system. I can create a follow-up order for us to contact the patient in a week or follow up regarding a specific item. Again, assign that to a staff member and put in any notes that are pertinent and a due date. and whether or not we're expecting results. So I just made a follow-up to make sure that the breathing test was done that we are ordering them to have done within a week, which is slightly redundant, but sometimes patients may be scheduled for something and then they cancel. So the additional follow-up could possibly be very helpful. I do have a section for miscellaneous where you can type in any type of follow up or a message that you'd like to send to any of the staff members regarding this patient. And then I do have a section for records request. This is going to help us track that we are needing to send out a copy of the patient's encounter or a copy of additional records such as lab results, imaging results, etc., to either the patient, the guardian, or other healthcare providers. I'm going to go ahead and say that the patient is requesting a copy of their records. The requester type is going to be patient. I'm going to assign this to our clinical staff to put together and make a little note here to please send the patient's encounter to them through the TotalMD Direct portal. And we will be covering that in a separate video. The due date for this item is going to be the 11th because I want it done within 4 days of the patient's encounter. So I'm going to give myself 2 days before my reminder is prompted. And we are going to be expecting that that item gets completed, but we're not expecting any kind of result. We do have an additional coding tab, which is going to show you any of the SNOMED codes that you've used throughout the course of this patient's encounter. So it's a nice place to summarize what SNOMED codes are pertinent for this patient, should that become relevant. At this point, I'm going to go ahead and save our changes for the encounter. And if I were going to hand off a copy to the patient on paper, I would just go down to Print Clinical Summary. And this is the view that it pulls up in, just a rich text editor. And you can see Mary's name. We can scroll down through the encounter. This is what we've been compiling throughout this whole video. And then here at the top, we have a print button if you want to print it off for her. I'm going to close that and go back to my options menu here. I want to point out that we do have a patient amendment option here. So once we sign the encounter, if we needed to edit something inside the encounter, you would have to click Patient Amendment from Mary Grant's patient information screen in order to amend the encounter that's been signed or closed. I'm going to go ahead and click Sign Encounter now, and I want to point out we do have the option to print the clinical summary at this point if you were planning on handing it to the patient. We also have the option to forward the encounter to anyone that's listed as a user in the office so that you could forward it to them for signing, for example, the doctor. And I'm just going to click Sign. Now that the encounter's signed, I'm going to go back through a few additional options here from Mary's patient information screen. Under the Encounter Summary tab, we have a summary of the problems list. We can sort this by active problems, resolved problems, closed and unresolved problems, closed and resolved problems, or all problems. So I'm going to leave that as active, and you could scroll through this list and you find that we did have our throat pain problem listed in there. You can also look at differential diagnoses to include all differential diagnoses, removed, or potential differential diagnoses. And then we have a listing for all of Mary's encounters. So we can see all encounters, open encounters, or signed off encounters. If you're looking at all encounters, you can see if they're signed off right here or not. And we can also see that the initial exam encounter we just finished is now assigned to DR instead of the user that I was signed in under when I was creating the encounter. You can also see a summary of their vitals here, so that's a nice way to just compare and contrast where they were at previous visits versus the current visit. Of course, on the right-hand side of the screen, you do have a summary of the encounter that we have selected here. So here's the sore throat encounter. Here's the initial exam appointment encounter. So that's a handy little tool if you just want to scroll through the encounter and refresh what happened to your patient the previous times that they came in for a visit. If I need to amend an encounter that's been already signed off, which we know this one has, I just select it from the patient information screen and go to my options menu, look down until I find the encounters section, and I could click Patient Amendment. This lets you create a new amendment for that specific encounter. So I click New. And then down at the bottom, this is where you're going to plug in what you're requesting be amended. Really, this is just a legal way to track what you've changed once the doctor has signed off on an encounter. So we have the requested date and time. You can plug in a description for what you're changing here, and I will go ahead and say lab order. I'm going to make a change to the encounter. You can choose the demographics or other and plug in whatever other it is. And I'm going to select the initial exam appointment encounter. I'm going to go ahead and point out the source of the change is not the patient but the provider, and select our provider who completed the encounter. And my request, just as an example, is going to be also add in a lab order for a chest x-ray. On the right-hand side of the screen is where you put your decision. So for example, the left-hand side of the screen where the request goes in could be made perhaps by a clinical assistant who created the encounter and realized they missed something or made a mistake. The right-hand side of the screen is where the doctor themselves are going to accept or deny the amendment. And you can go ahead and plug in a reason or what the action should be going forward. For example, we issued a handwritten order to the patient via mail to have chest x-ray completed. And at this point, we'll go ahead and just click Save Amendment. And now we have an amendment that was accepted to that signed off encounter. The next part in this process that I want to show you is under the Activities menu, and we have the Encounter Charge Entry section. This is where we're going to take the charges from a given encounter and add it to the patient's ledger. So keep in mind that the encounter charges that we have here are based on the procedures that the doctor added to the encounter as performed procedures. You may not want to post the charges from here. You may have a biller who manually posts the charges based on a super bill that you guys are using. So if you wish to not use this section, that's perfectly fine. However, if the doctor's pretty good on signing off on their encounters, this is a great and effective tool to go ahead and import those charges from the encounter into the patient's ledger so that they become billable items. Just going to scoot a few things over here so you can see more on the screen. So we have the patient's chart number and name, the billing number that these charges would get assigned to, the date of the charge, and the actual procedure codes. We have the description that we're charging for, the number of units, which we can click and change here. And the units is changeable on the encounter when we were creating it and adding these charges as well, just to point that out. The fee that we're charging, the provider who completed that item, and any modifiers that are required. Once again, the modifiers were also available inside of the encounter when we were creating those charges. Here we're going to go ahead and plug in our diagnosis codes. If we had multiple diagnoses, for example, that we had not added previously, we could go ahead and plug those in here. And then these little D1, D2, D3, D4 boxes are there to indicate which diagnosis applies to this given procedure code that we have here. So I can say only diagnosis 1 and 3 actually apply to this line item. I'm going to go ahead and use the scroll bar at the bottom of the screen to move over a little bit here and point out a few additional options. We can mark items as do not bill insurance or do not bill patient. We have a place of service code and a type of service code, the allowed amount if we do have that information, and if the insurance has paid for anything, which of course they haven't quite yet, or this patient does not have insurance. So if they did have insurance and it has not been paid for as of yet, which would make sense in this moment, this box will be left open. Once the insurance has paid, or if they do not have insurance, the box will be closed, as in completed. I do want to point out if you need additional spaces for more diagnoses or other options in this screen, you can go to the left to customize your view. And the left-hand side here is all of the items that you have available to move over to the right-hand side of the screen, which are your viewed fields. I may, for example, want the time units on this encounter charge list, and I can move that over here and click the OK button. And now time units is something that I've added to this encounter charge list. Once I have the details of the charges laid out the way I would like them, I'm going to go to my options menu and just click post and close. I do get a question if I want to post the charges before closing. I'm going to say yes. And now if we jump over to the ledger for Mary, we're going to find that those charges are there ready to be billed out to her insurance if she had any. And in this case, she does not, or we're ready to go ahead and collect the money that Mary owes for these items. So here is our office visit, mammogram screening, and our chest x-ray. Going back to the patient information screen, one tip on that is to just keep in mind you won't be able to do the encounter charge entry for encounters that have not been signed off from the doctor. So if that is something that you will want to use, you'll want to make sure that the doctor is staying on top of their encounters and signing those off after checking them over daily. And to that point, I want to go ahead to the list menu and take a look at the encounter list. The encounter list is going to show you all of the encounters that have been created. I do have some filter options up here at the top of the screen. For example, if I only want to see encounters assigned to user number 1 or to user doctor, or only encounters from a given date range. And here's Mary Grant there. From the encounter list, you also have the option to edit the encounter if it has not been signed. Delete the encounter, create a new encounter. You can copy an existing encounter, sign it here, and also print the clinical summary. So if the doctor is looking for a centralized place to go to review the encounters that he or she needs to sign off on, the encounter list is the perfect place to do so. The one other place I would go to review any pending encounters that need to be signed is the home page. If we click on the home page, at some point you may recall that we added View Unassigned Encounters to the home page, and we could select that. It'll show you the encounters that need to be signed for just the person who's logged into the system and who those are assigned to. I do want to take a step back and get back into this encounter that we just finished and point out the Orders tab. There are a number of tests listed here for in-house tests, lab tests, and imaging and radiology. You may find that some of the tests or labs that are in the system are not pertinent to what you may want to have. In order to customize this, you're going to go to the Setup screen and you're going to click on Setup Lookup Table under the EHR Setup. Inside this screen, we have a lookup list, and we can use our drop-down menu and take a look at inside lab orders that we have set to be displayed. If you don't, for example, do a gastric intubation and aspiration test inside your practice, you can deselect that as one that's displayed as an in-house order. And we could go through a number of these to hide them from our list. You do also have a filter, so for example, if I want to rule out any blood tests, I can type in the word blood. It only shows me the tests that have the word blood in them, and I can simply deselect all of these and save my changes so that they're not displayed when I get to the orders section for any given patient on the encounter. Also, really quickly to go through the other options available, under this lookup list, we have the encounter functional status, and we created the mental disorder status. So this is something that we could choose not to display if for some reason we don't want that as an option for people to choose. We also have immunization options. We have lab results, other types of orders, and then we also have the patient's language as an option as far as what we don't want displayed on the patient information screen or coming over onto the encounter. So that's a really handy item to edit before you start using the system really in depth so that you have less to scroll through when you are creating orders for your patient. Also under the list menu, we have patient search and reminders, decision support, and the orders list. Under the Activities menu, we have importing a CCD file, which is essentially importing an encounter that another provider sends you. We have linking records. We have immunization reporting, TotalMD Direct, which is the portal that we'll use for our patients, and the provider dashboard to help you meet the attestation process if you're doing meaningful use. We're going to go ahead and cover these in depth in our next video. Thank you so much for your time and joining TotalMD.